Bismillahirrahmanirrahim. Quote of the day. If you can do great things, do small things in a great way. I am Dr. Hussain Mahmood, PGR from Community Medicine. Today I am presenting on Global Strategy on Human Resources for Health Workforce 2030 under kind supervision of Professor Dr. Saira Afzal. Learning outlines, vision, goal, objective and milestones of World Health Organization Global Strategy on Human Resources for Health Workforce 2030. Learning objectives. By the end of this presentation, participants will be able to describe who developed a global strategy on human resources for health. Why is having a global strategy on human resources for health is necessary? Who are health workers? Why are health workers important? What is vision, goal, and objectives? Who developed a global strategy on human resources for health? In paragraph 4 of that resolution, member states requested the Director General of World Health Organization to develop and submit a new global strategy for human resources for health for consideration by the 69th World Health Assembly. And if the final version of the global strategy on human resources for health was considered by the World Health Organization member states at the 69th World Health Assembly in May 2016. Why having a global strategy on human resources for health is necessary? We have better evidence than ever before on what works and what doesn't in health workforce development across different aspects, ranging from planning, education, management, retention, and incentives. Linkage with the social services of health workforce. A global strategy that address in an integrated way all these aspects can inspire all inform more incisive multi-sectoral action based on new evidence and best practices at national level by planners and policymakers and at global level by the international community. Why do we need it now? The international community is working to identify a new set of global development goals for period of 2016 to 2030. In this, the health workforce is one of the area under consideration as part of purposed health objectives. The development of goal strategy on human resources for health now is therefore very timely because in its early stages, the process to develop the global strategy on human resources for health can also influence the decision on the post-2015 development agenda. And once these broader goals and targets have been set at a political level, the global strategy on human resources for health can now provide concrete recommendations and ideas on how to achieve them at a more technical level. Who are health workers? According to World Health Organization report 2006, the health workers are all people engaged in actions whose primary intent is to enhance health. These includes physicians, nurses, midwives, laboratory technicians, public health professionals, community health workers, and pharmacists, and all other support workers whose main function relates to delivering preventive promotive, or curative health services. Why are health workers important? Health workers are the core of health system. Without health workers, there is no health care. National and global effort to achieve the health targets of MDGs set by the United Nations in 2000 are thwarted in many countries by shortage of health staff, their often inequitable distribution, and gaps in their capacity, motivation, and performance. Similarly, the ambitious target under consideration by the United Nations as part of SDGs and will replace the MDGs, which only be achieved if dramatic improvements are made to strengthen the health workforce. Isn't this a problem just for the poorest countries? Low and middle income countries face the most severe challenges in ensuring a sufficient fit for purpose and fit to practice health workforce. A recent analysis conducted by World Health Organization Workforce Alliance and World Health Organization established estimated a gap of 7.2 million professional health workers in 2012, set to rise in 12.9 million over the next decades. Countries at all levels of socio-economic development face the challenges of how to sustain the human capital required to guarantee universal access and universal health coverage. With so many competing development priorities, are health workers worth the investment required? Investment in health workforce is one of the best buys in public health. For instance, investing in midwifery education with development of community-based service can yield a 16-fold return on investment in terms of life saved and cost of cesarean section avoided. In addition, in evidence is started to emerge on the broader socioeconomic impact of investment in the health workforce in terms of improving synergies with education, creating career opportunities for women, facilitating decent employment in the formal sector, and fueling economic growth. Vision: accelerate progress toward universal health coverage and the United Nations Sustainable Development Goals by ensuring equitable access to health workers within strengthened health system. Overall goal: to improve health, social and economical development outcome by ensuring universal availability, accessibility, acceptability, coverage and quality of the health workforce through adequate investment to strengthen health system and the implementation of effective policies at national, regional and global levels. The principles of human resources for health workforces: promote the right to the enjoyment of the highest attainable standard of health, provide integrated people-centered health service devoid of stigma and discrimination, foster empowered and engaged communities, uphold the personal employment and professional right of all health workers, including safe and decent working environments and freedom from all kinds of discrimination, coercion, and violence. Eliminate gender-based violence, discrimination, and harassment. Promote international collaboration and solidarity in alignment with national priorities. Ensure ethical recruitment practice in conformity with the provisions of the World Health Organization Global Code of Practice on the international recruitment of health personnel, mobilize and sustain political and financial commitment and foster inclusiveness and collaboration across sectors and constituencies, promote innovation and use of evidence. Now, objective of human resources for health. First objective is optimize performance, quality, and effect of the health workforce through evidence-informed policies of human resources for health, contributing to health lives and well-being, effective universal health coverage, resilience, and strengthen health system at all levels. The milestone achieved by 2020, all countries will have established accreditation mechanism for health training institutions. By 2030, all countries will have made progress toward having inequalities in access to health workers. By 2030, all countries will have made progress toward improving the course completion rate in medical, nursing, and allied health professional training institutions. The second objective is align investment in human resources for health with the current and future needs of the population and health system. Taking account of labor market dynamic and education policies to address shortage and improve distribution of health workers so as to enable maximum improvements in health outcomes, social welfare, employment creation, and economic growth. Milestone achieved by 2030, all countries will have made progress toward having their dependency on foreign trained health professionals implementing the World Health Organization Global Code of Practice on the international recruitment of health professionals. By 2030, all bilateral and multilateral agencies will have increased synergies in official development assistance for education, employment, gender and health in support of national health, employment and economical growth policy priorities. By 2030, partners in the Sustainable Development Goal will have made progress to reduce barrier in access to health services by working to create, fill, and sustain at least 10 million additional full-time jobs in health and social care sectors to address the need of undeserved population. By 2030, partners in the United Nations Sustainable Development Goals will have made progress on Goal 3C to increase health financing and the recruitment, development, training, and retention of health workforce. The third objective is building the capacity of institutions and subnational, regional, and global level for effective public policy stewardship, leadership, and governance of action on human resources for health. Milestone achieved by 2020, all countries will have inclusive institutional mechanism in place to coordinate in intersectoral health workforce agenda. By 2030, all countries will have human resources for health unit with responsibility to develop and monitor policies and plans. By 2020, all countries will have regulatory mechanism to promote patient safety and adequate oversight of the private sector. Objective 4, strengthen data on human resources for health for monitoring and accountability of national and regional strategies and the global strategy. Milestone achieved by 2020, all countries will have made progress to establish registries to track health workforce stock, education, distribution, flows, demand, capacity, and remuneration. By 2020, all countries will have made progress on sharing human resources for health data through national health workforce accounts and submitting core indicators to the World Health Organization Secretary annually. By 2020, all bilateral and multilateral agencies will have strengthened health workforce assessment and information exchange. Annex Health Workforce Requirement for implementation of the Global Strategy of Human Resources for Health. This is the tables which shows stock of health workers in 2013 and 2030. Total health workers in 2030 is 43.5 million and in 2030 is 67.3 million. Total percentage is 55% change. The 2006 World Health Report achieved 80% coverage of assisted deliveries by the threshold of 2.3 skilled health workers per 1,000 population. In considering our new health workforce threshold, the focus must be shifted to reflect the broader range of services that are targeted by the USC and SDGs. Coverage data for all countries available for the 12 indicators were combined in an aggregate coverage indicator, which weighted to importance of specific indicator based on the contribution of disease they track to the global burden of disease. This is graphical representation of 4.45 physician, nurses, and midwife per 1,000 population was identified. This is the graphical representation of estimated health workers need-based shortage. This is health worker demand graphical presentation. Annex 2, a noted list of selected World Health Organization tools and guidelines for human resources for health, transforming and scalping up health professional education and training, task shifting for HIV and optimizing health workers' roles for maternal and newborn health, increasing access to health workers in remote and rural areas through improved retention, monitoring and evaluation of human resources for health with special application for low and middle income countries, analysis disrupted health sectors. Annex 3, Monitoring and Accountability Framework. The monitoring and accountability framework for the global strategies entails a regular process to assess progress on its milestone. Global accountability will include a progressive agenda to implement national health workforce accounts with annual reporting by countries on core human resources for health indicator to the World Health Organization Secretariat. Monitoring and accountability framework to assess progress on the global strategy milestone. This is global milestone achieved by 2020 with baseline indicator in 2016. These are global milestones achieved by 2030 as baseline indicator in 2016. Code WHO Secretariat activities in support of implementation of global strategy. Develop normative guidance, facilitate the sharing of best practice, provide technical cooperation on health workforce education, optimizing the scope of practice of different cadres, gender mainstreaming, availability, accessibility, acceptability, coverage, quality control, and strengthening of public regulation. This provides technical cooperation and capacity building to develop core competency in policy planning and management of human resources for health focused on health system needs. foster effective coordinations, alignment, and accountability of the global agenda on human resources for health by facilitating a network of international stakeholders. Now, recent updates. This article is the global health workforce stock and distribution in 2020 and 2030, the threat to equity and universal health coverage. The objective, this article provides an assessment of health workforce stock in 2020 at present, a revised estimate of project shortage of 2030. Methods. Latest data reported through World Health Organization's National Health Workforce accounts were extracted through excess health workforce stock by 2020. Using a stock and flow model, projections were computed for the year 2030. The global health workforce shortage estimation was revised. Results. In 2020, the global workforce stock was 29.1 million nurses, 12.7 million medical doctors, 3.7 million pharmacists, 2.5 million dentists, 2.2 million midwives, and 14.9 million additional occupations, tallying to 65.1 million health workers. It was not equitably distributed with a 6.5 fold difference in density between high million health workers. This represents an average growth of 29% from 2020 to 2030, which is faster than the population growth rate 9.7%. This reassessment presents a decrease to 10 million health workers by 2030. World Health Organization African and Eastern Mediterranean region shortage are projected to decrease by only 7% and 15% respectively. Conclusion. The latest data show progress in the increasing size of the health workforce globally as more jobs are and will continue to be created in the health economy. It, however, was considerable inequitable, particularly in WHO African and Eastern Mediterranean region, and alarmingly among the 47 countries on the World Health Organization Sport and Safeguard list. Progress should be acknowledged with caution considering the immeasurable impact of COVID-19 pandemic on health workers globally. Now MCQs. First MCQs. To achieve a certain target, a minimum number of human workforce is required. According to 2006 World Health Report, how minimum skilled health workers per thousand population are required to achieve 80% coverage of assisted deliveries. A 1.3, B 2.3, C 3.4, D 4.45, E 9.9. It's B 2.3. Health system can only function with health workers and by improving their health service coverage by merely availability, quantity plus availability. C is quality only. D is availability plus accessibility plus acceptability plus quality. E is accessibility. Option is B, quantity plus availability. All people engage in actions whose primary intent is to enhance health, and all other support workers whose main functions relate to delivering preventive, promotive, or curative health services are the health workers from the list given below, which are not the health workers: laboratory technician, public health professional, non-profit organization workers, community health workers, and pharmacists.
A.
C. Non-profit organization workers are not the health workers. The planning, design, and implementation of the policy option can be informed and supported by a number of tools and guidelines. Which of the following is not considered as a selected product developed by WHO on human resources for health? A is scaling up health professionals, education and training, in increasing access to health workforce in remote and rural area, monitoring and evaluation of human resources for health, ignoring disrupted health sectors.
D.
D, ignoring disrupted health sectors. Considering the cost benefit analysis, what do you think that investment in which of health area is one of the best boys in public health, as it is the core of health system? Health workforce, health infrastructure, health related equipment. D is health related diagnostic laboratories, and E is health education. A, health workforce. The monitoring and accountability framework of global strategy entails a regular process to assess progress on its milestones. Which of the following milestone is not necessarily to achieve for the leadership and governance of actions of human resources for health? A is institutional mechanism in place to coordinate an intersectoral health workforce agenda. Have a human resources for health unit with responsibility to develop and monitor policies and plans. C. Have regulatory mechanism to improve patient safety. D. Made progress to establish registries to track health workforce. E. All agencies would have strengthened health workforce assessment. It's D. Made progress to establish registries to track health workforce state. Health workers are the core of health system, and without health workers there is no health care. Which of the following best describe that the investment in health workforce is one of the best boys in public health? A. Investing in midwifery education can yield a 16-fold return on investment in terms of life saved. B. Establishing a hospital will benefit the whole town. C. Installing modern equipment will give the best result. D. Road traffic signals can prevent death due to road traffic accident. E. More expenditure on health infrastructure. It's A. Investing in midwifery education can yield a 16-fold return on investment in terms of life saved. Health system can only function with health workers. Improving health services coverage and realizing the right to the enjoyment of the highest attainable standard of health is not dependent on their A. Availability, B. Accessibility, C. Acceptability, D. Assessment, and E. Evaluation. It's D. Assessment. Which of the health area has a vital role in building the resilience of communities and health system to respond to the disaster? Health A. Health workforce. B. Health infrastructure. C. Health related equipments. D. Health related diagnostic laboratories. And E. Health education. It's A. Health workforce. According to the World Health Organization, at which threshold level of an aggregate density of physicians, nurses, and midwives per thousand population was identified that will correspond to the median scores of 25% of SDGs tracer indicator attainment. A is 2.35, B is 3.36, C is 4.45, D is 5.59, and E is 6.78. It's C, 4.45. This is key for our MCQs. This is our YouTube channel. Kindly like and subscribe. Thank you so much.